Mrs. Stroder, it's good to see you. I have a few questions for you before Dr. Stafford comes in, okay?
Sure.
All right. The first question that I have for you, and I just have a set of 4, okay, is in the past 2 weeks, how often have you been bothered by little interest or pleasure in doing things?
Never.
Okay. Can I give you some of the answers for that?
Sure.
There's not at all, several days, more than half the days, and nearly every day.
Not at all.
And that is not good. In the past 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless?
Several times
Several?
a day.
Okay. The next question is regarding alcohol, and so I have a different set of answers for that.
Okay.
In the past 2 weeks, how often have you drank alcohol? And the answers are never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week.
2 to 3 times a week.
Okay, thank you. And the last question that I have for you is, in the past 2 weeks, or actually since you've been seeing Dr. Stafford, or as far back as you can remember with medication with doctors, have you ever used prescription medication differently than what Dr. Stafford or another provider has given you?
No.
No.
Never. Why are we asking all these questions for? I thought I was just here for my hyperlipidemia, my hypertension.
You're right. You are here for your hypertension. But there has been a study that shows that there is a link between mental health and alcohol consumption with some diseases, and hypertension is one of them. And so Dr. Stafford really wants to look at the relationship between how you are doing and your mood.
Okay.
Looking at the information that you provided from the screening that you completed with Nancy today, it looks like there's some degree of stress and worry in your life, and that there's been some alcohol use. In looking back over the last few years, I see that your red blood cells have been a little bit enlarged, and that can be a sign of drinking too much alcohol. We've also had a problem getting your blood pressure under good control. I've had to increase the doses of medication over the last few years, and it's still not working well.
Yeah, it has been some problem.
Well, we'll get back to that, but first let me just let me check that spot on your forehead from that lesion that I removed last month. Is it bothering you at all?
No, just it was itched for a few days, but it doesn't bother me anymore.
Good. Well, it looks like it's healing well, and that little red spot there is just a little scar, and that should fade over time.
Okay.
So I have this colleague in our practice, Dr. Kessler, who likes to work with folks who aren't getting quite the results they like to get. So he's an expert in how mood and things like alcohol and stress can affect a person's health and medical conditions. And I'm wondering what you would think about having him come and sit down with us, talk with us briefly about how things are going and how your thoughts and behaviors might be affecting your health. What would you think about that?
Well, if you think it's the best choice to do, then
yeah.
we could do that.
Okay. Well, I do. I think it would be good to get another point of view.
Okay.
Dr. Kessler, thanks for joining us.
Hello.
This is Mrs. Stroder.
Hello,
Hi,
Mrs.
nice to
Stroder.
meet
How you
you.
doing? I'm Rodger.
Hi.
So we've been working on managing her blood pressure. I've had to increase her blood pressure medicine doses over the last few years without really good effect. And I'm worried about the trend that I'm seeing. And I'm wondering what thoughts you might have. We did finish the behavioral health screen today, and some of her answers show some concern regarding mood and alcohol use.
Oh. And have you talked about whether there's any relationship between the mood, alcohol use, and hypertension at all?
I have alluded to it and thought that perhaps you could help us more with that.
So I have a little bit of a strange job.
Okay.
I'm a psychologist that works in the practice, and I don't really do very much regular psychology. The work that I do is working with folks who have medical issues that mood or substances or alcohol or stress are influencing either the medical problem or sometimes people's ability to do the things that would make the medical problem better. So Dr. Stafford and I work together a lot. And so when he called me in to talk with you, it's something that we do pretty regularly. And so do you think that there may be any relationship between possible stress and drinking, and maybe that works its way around to how come the hypertension has been a little difficult to control?
I have been under a lot of stress lately.
I see. And do you think you're doing a good job managing the stress?
Trying.
Uh-huh. So sometimes it's helpful as part of medical treatment to spend some time with me, usually only a few visits, and to try to look at some of the issues related to stress and some of the issues related to alcohol and see if we might be able to manage them any more effectively. And I'd be happy to do that if you were interested.
Can try that.
Great. Then why don't we go on down the hall and make an appointment when you can come in to see me?
Okay.
Okay?
We can try
At
to
your
do that.
convenience. Great. Well, thank you very much. And thank you, Dr. Stafford, for asking me to come in.
You're welcome. Thanks for being here.
Good afternoon.
Good afternoon.
It's good to see you again.
Good to see you.
So my recollection when we spoke with Dr. Stafford is that we decided to get together to talk about stress and alcohol use and hypertension and to see if they have any kind of connection.
Okay.
What do you think?
It would be a good idea. I can try to see what's going on.
Great.